Good afternoon and welcome to this meeting organized by the combined European patient groups in the brain space, Alzheimer Europe, EFNA, the European Federation of Neurological Associations, and GAMIAN Europe, the Global Alliance for Mental Illness Advocacy Networks Europe. This meeting is a unique landmark meeting because for the first time these three leading European patient groups have joined forces in a co-productive and co-engaged manner. My name is Joke Jijsma. I'm president of EFNA and I'm very happy to welcome you to this meeting. First, I would like to do a little housekeeping. We have a very large audience today, so during the meeting, you will all be muted and we cannot see you. But you can communicate by way of the chat function. So if you have questions, comments, or feedback that you would like to send to us over the course of the next 2.5 hours, please use the chat function and our team will take care of organizing the discussions and they are facilitating the answers by the speakers. We will be live during the meeting and the meeting will be recorded. Afterwards, the entire meeting will be made available to you on the YouTube channels of our respective organizations. The main reason for organizing this meeting has been that there has been a recent series of publications and meetings that currently take place on brain health and at policy level. In all this, we felt that overall patient involvement was not optimally represented, and even more so that in this very year 2022, relatively little impact on patient care and diagnosis can yet be seen. As the combined European patient voice, we follow the discussions and policy developments very carefully and much realize the significance these have for our members, the patient community, and ourselves, the leading organizations representing these hundreds of millions of Europeans. I will mention just a few examples. In the public health arena, DG Santé's NCD initiative Healthier Together, which now includes mental health and neurological disorder, was great news for all of us. It meant not only that brain disorders are now part of the first league of Santé priorities, but also that for the first time, the Commission is going to provide a framework to address priority NCDs in a systemic way. We are delighted to have Dr. Stefan Schreck today of DG Santé, who will speak on this topic in more detail. Other important plans and developments are, for example, EBRA, the European Brain Research Area, the Innovative Health Initiative, of course, and importantly, the Brain Health Partnership, as well as SIBA, which perhaps may be seen as a rewriting of the research vision of Europe. E-brains are actively positioning their part. Equally important, we felt, are the developments at global level. WHO's 10-year Global Action Plan, which will be adopted later this month at the World Health Assembly, is going to provide national policies, strategies, plans and frameworks, awareness campaigns and advocacy programs to be implemented. And this is where we as patients want to be fully involved as well. All of this made us decide that we need to emphasize together the importance of engaging the patient community in these discussions, now that the momentum is here. The first part of our meeting today will focus on the actual and desired impact of patient involvement, followed by our views on how this may be achieved. We are very happy to have great speakers for this session. And after that, we will move on to involving patients and the impact that patient involvement will have, followed by how and where this may or should be improved. Two excellent speakers from within our patient communities are going to expand on that. In the discussions after each roundtable, we will discuss how to advance a coordinated strategy. With that, I will close my introduction, and it's my great pleasure to introduce to you today's keynote speaker, Professor Gwendalina Gravigna, Professor of Social Psychology at the Catholic University of Sacred Heart of Milan. Her study on patient engagement is crucial to today's meeting. So with that, Gwendolina, I'm very happy to hand over to you. Thank you and enjoy the meeting.
Thank you very much for your kind words and for the introduction. I'm very happy to participate in this meeting. I really would like to testify how it is important today to discuss about patient involvement, not only in self-management, but more and more in research, in policy, and in practice. So we have data about the dramatic increase, the fantastic increase of literature, scientific literature that is dedicated to study what are the conditions for involved patients in their care, but in particular that are discussing the results, the impact, the return of engagement, meaning what are the concrete reasons why to involve patients in their care. We have done a bibliometric study, just a description to see how the literature is increasing across here. And we counted that if in 2009 only 48 scientific papers were indexed in the Scopus database with the keyword patient engagement, in 2020, 522 papers only in 1 year indexed with the keyword patient engagement were published. So even though we are still discussing about a small amount of scientific literature, because we know that in medicine we should acquire tons of evidence and tons of papers, but on the other hand, this data is very interesting because show a very important increase of the scientific effort across the world in order to build evidence about patient engagement. In the last 10 years, thus, scientific discussion about the whys for opting for patient engagement is increasing. But even though today I think there is an agreement across the world about the importance of raising the voice of patients in their care, still, we need to join effort for sharing practices, effective practices to make this real, and also to avoid inequalities in patient engagement. Still, I have the feeling sometimes that speaking about patient engagement risks to be more a fashionable claims that a real orientation for action. And this is a risk that we cannot have. We should fix this practice. I think that today patient engagement is crucial even in preclinical biomedical research, because it means that patients can become co-researchers, can orient the scientific process of research, because with their insight, with their experiential knowledge, they should complement the scientific knowledge of the expert. But let me clarify a little bit what I mean, at least from my perspective and the literature we study about patient engagement, because many times some clinicians or some colleagues say to me, but this is nothing new since patient-centered care. So what is the novelty from what we have already been discussed for decades about patient-centered care? Actually, yes, patient engagement and patient involvement is today possible thanks to the shift of paradigm in medicine given by the patient-centered care paradigm, where as a clinicians, we started to consider the patient not only in his or her biomedical requirement, but also in terms of their illness, meaning the psychosocial perception of the impact of the disease and the treatment on quality of life, and also considering the sickness, meaning the impact of disease and treatment on the social inclusion of the person in their community. So patient-centered care have taught us the importance of considering the person suffering for a disease in a very 360-degree perspective, considering all the different components of this experience, and this leading to a coordinated and integrated action among the different professionals in order to make the best care for this patient. But actually, still in patient-centered care, we still focus on the person, on the patient as the target of an action. The patient is put at the center, where the other professionals are active and doing something for him or her or on behalf of. Patient engagement is a totally different paradigm because it means that the patient is part of their care. Such in a metaphor, since I think we all agree in considering that air care is today a good air care today require a good teamwork, like in soccer or in all the team sport, where all the different professionals or the different specialists, psychologists and different clinicians work all together in order to provide the best care. So I think we all agree on this, that we need to really collaborate as professionals. So we also have to consider that today the patient cannot stay on the bench, but the patient should play the game in the team as well. This means that the patient should be educated, supported, have all the information required in order to play his or her role in the team. And also this means that the patient as well as the clinician need to recognize the complementary of the different roles. A patient cannot become a physician, and also the opposite. The different roles are complementary, and everyone needs to respect the important contribution that for the achievements of the final goals of health, everybody should give. Furthermore, today I think we should move forward from considering that we should provide the best service as possible to patients, to considering that we should involve patients in order to create the best care service as possible. So patients are not the end users of their care, are not the end user of a drug or whatever technological device, whatever clinical therapy. Patients should co-create the best pathway of the clinical service, of the clinical care for them. And this because, as I mentioned before, today we start to have a lot of evidences in favor of improving patient engagement. And this evidence starts from one assumption. That means that today the level of patient involvement and the engagement in the care can be measured, can be assessed. And this is another very crucial element, because in medicine we know that what counts is something that can be diagnosed, that can be studied. Now also patient engagement can move forward, not only being a dream, not only being a general statement, but it is a clinical and organizational parameter. There are scales to measure this. And if we measure this, then we can see the correlation between the parameter of the level of engagement with many other clinical parameters. And now in the literature, there are evidences that higher patient engagement impact on a higher patient adherence to treatment, that a higher patient engagement related to a higher frequency of preventive behaviors, that a higher patient engagement improve the therapeutic alliance with their care team, and also a higher patient engagement create a higher satisfaction for the care pathway. Finally, some evidences show that the higher is the patient engagement level, the lower are their care costs, because there is an improved usage of the care resources. So having said this, I also believe that now we should move forward towards a scientific approach to improving patient engagement in care. And this means that we need a taxonomy for understanding what are the different settings for engaging patients and what are the requirements, the methodological requirement for engage them. I wanted to quote an Erin Moore tweet from 2016. Erin Moore, probably you know her, is an influencer in the area of patient engagement, one of the first advocating for a higher involvement of patients in their care. But in 2016, she wrote a quote saying, "I hate the term patient engagement because no one is more engaged, involved than the patient. I want researchers, clinicians, and this industry engaged as well." That's the key, I guess. So we should avoid considering patient engagement only a matter of the patient. In order to achieve a meaningful patient engagement, we should change the ecosystem in which patients can get involved. This means providing policies that will improve participation. This means support healthcare professionals to acquire a new culture of participation in healthcare. This means also to create the setting that support in order to make patients able to raise their voice, their voice. And also this means starting to assess in a more systematic way patient engagement, both for understanding the ability to get engaged of the patients. There are some patients that because of clinical conditions, because of cultural conditions or contextual condition cannot get engaged. And we risk to create a big inequality in the opportunity to get engaged in the different setting of care. In order to avoid inequality, we should first questioning who are the patients that are engaged so far, and who are the patients that are missing, and why they are missing. And we should outreach them, and we should guarantee that also those persons can raise their voice in order to improve their care. Finally, I wanted to clarify that when we speak about patient engagement, we have a multiple variety of opportunity where to engage patients. It's not only self-management, although this is a very crucial and important setting, meaning to make the patient more autonomous, more protagonist in their care. But also patient engagement today is doable in drug development, meaning that even in the design of trials for drug development, the patient can get engaged and raise their voice about what are the outcomes that need to be achieved and measured for assessing a new drug. Same for health technology assessment, in order to define if new innovation, new devices are usable, if they are needful in the community, if they are good enough, so patients can judge them, should give their point of view. But the same in policy development, we need policy that support patient participation, and policy needs to have the insight from the patients. But also personalized care. We discussed a lot about personalized care, mainly in a biological perspective, in a genetic perspective. I think that there is also a matter of the quality of their care, the quality of the experience of their care, and this should be personalized according to the experience of patients. So the measurement of the experience of patients, the expectation of the patients toward care should be considered in personalized care. And finally, shared decision-making as well. So the treatment should be evaluated and co-designed and defined together with the clinical team and the patients in order to be the best for that person. And finally, I mentioned it before, all the co-design, co-creation of services, of structure, of new technologies. Patient can give a creative input together with designers, with engineers, with all the different experts that have a new novelty, but this should be co-created with the people that they will have to use and adopt at the end of the day, the new tool. I conclude saying that in order to achieve this, we have some requirements. First of all, I think that it's not anymore a matter of discussing why patient engagement is important, but we should define how. And how can be differentiated according to the different goals of engagement, according to the different settings of engagement. We should ensure that patients are engaged in many different phases of their care, in many different organizational settings of their care, but all these different settings require a specific analysis of constraints and the enable of patient engagement. And so we need a scientific taxonomy of engagement. We need a rigorous methodology of engagement. Today, a science of patient engagement is growing. Let's make this grow even more, and let's use this science in order to make less superficial approach to patient engagement. We do not need a tokenistic approach to patient involvement. We need a critical approach to patient involvement, because if not, we will risk to create inequalities even in this area. COVID-19 pandemic has enhanced the attention about the importance of changing models in care, and also about the important role of patients, citizens in care in order to successfully overcome crises. So I hope that the pandemic also could be the turning point to improve the practices of patient engagement in a more meaningful and reflective way for the sake of all of us. Thank you very much.
It was a really beautiful and encouraging talk, and we've all listened very carefully. Sorry, there were things on the screen. To what you've said, I'm particularly enthusiastic about your mentioning a new future of participation in a new ecosystem, which I think is exactly what this meeting today is about. And you will hear that some of our speakers are going to address that in more detail. So thank you very much for this beautiful talk, and we'll now proceed to our next speaker, who is Orla Galvin. Orla is EFNA's new executive director since earlier this year. And she came to us from Retina International, which is another patient organization. She holds a PhD in medicine and brings much experience and expertise to EFNA. So Orla believes in strengthening the patient voice. She's passionate about this, and also about policy actions in support of human rights and the multidimensional aspect of health. So Orla, please go ahead, and we are eager to listen to you.
Thank you, Luca. As I wait for the ability to share my screen, it's popped up now. Thank you so much. We can get moving on this now.
You can see it.
Excellent.
Okay.
So United was a patient voice representing brain health conditions and disorders. Wish to ask of all of those listening today is for early engagement in patient involvement processes, which are transparent. So what does this really mean? This means that we're asking for well-defined, transparent processes that are systematically embedded and ingrained in how you conduct your work stream. This is regardless of what area you are working in. It applies to all stakeholders who play a role across all sectors, of research and development, of approvals and reimbursement, and of delivery of treatment and care pathways. And this does not exclude governments. Governments play a role here too, to support people who are affected by brain health disorders. Brain health disorders, as of 2017, have been reported to cause 1.2 million premature deaths across Europe. And this represents 24.3% of those associated with non-communicable diseases, and has accounted for 34.6 million disability adjusted life years, representing almost 27% of those associated with non-communicable diseases. Therefore, brain health disorders constitute the most prevalent, disabling and burdensome disease among non-communicable diseases in the European region. In terms of burden, 1 in 3 Europeans are affected by a brain disorder, and that number year on year is getting closer to 1 in 2. So no matter who you are listening in today, this affects you directly, your family, your friends, your neighbours, your work colleagues. You are not removed from this discussion. 2/3 of those people receive absolutely no treatment, and yet 295 billion euro per year is spent directly on healthcare. And the total economic cost per year of brain disorders in Europe is 798 billion euro. So let's stop wasting money, let's stop wasting time, and expedite the benefits to people by involving people living with brain health disorders and those who care for them, because they are the true experts of their conditions and their lived experience. We need to ensure that patient involvement processes support that what is being developed is fit for purpose. We need to ensure that processes are meaningful and lead to shared decision making. And that means we would also like to ask for evidence of the impact of patient involvement in these processes, so that they are not just tick box exercises, that they are not just lip service to the patient population because patient involvement is trending. We want to ensure that involvement processes are also really respectful of time and resources of those who are involved, because you need to remember that there is an added effort for people to take part in these processes compared to the general population. Involvement is distinct, and often this can lead to confusion, particularly around 3 words: participation, engagement, and involvement. And oftentimes what we see is participation, and this is absolutely not involvement. And it's the easiest one to remove from the involvement discussion, because participation refers to when people are the subjects, when people take part, for example, in clinical trials or in surveys. Engagement is a little step closer. It's an improvement. Engagement refers to the connection with patients or public audiences to share or describe their processes, their research, their news. There may be a dialogue, but in this dialogue, when it comes to engagement, there's no influence. The involvement of people does not influence any decision making. What we are asking for is true involvement. We're asking for actions that are with or by patients and the public, rather than to, for, or about them. In this situation, communication flows in both directions, and each stakeholder's opinion is of equal value, and the involvement of patients and the public has an influence with an outcome. So what are the actionable areas? As we mentioned, United, the patient voice of brain health in Europe, calls on national and EU governing bodies to develop, and where developed, implement policies to ensure early and meaningful engagement to support involvement of patients across all sectors involved in brain health. Specifically, we seek to promote a human rights-based approach in all policies and research affecting people living with brain health conditions, to prioritize patient needs in setting the research agenda, to review funding proposals for research, to access, review, and report on access to diagnosis, therapeutic intervention, and care pathways, to support access to and design of clinical trials and the design and use of patient-reported outcome measures, to support approval processes for therapeutic interventions, to contribute with industry to patient-centric design and research development and commercialization, and to optimize data sharing for patients and society. So again, I remind you, what does this really mean? What is the take-home message? What we need are well-defined, transparent processes that are systematically embedded and ingrained in how you conduct your work streams. That applies to everyone, to all stakeholders who play a role across all sectors of research and development, approvals and reimbursement, delivery of treatment and care pathways, and to government to support people affected by brain health disorders. And with that, I would like to thank you for listening to what our call for action is, and hand back to Luca Jarsma.
Thank you so much, Orla. And that also was a brilliant presentation that gives us a lot of food for thought, and we are definitely going to be expanding on this during the coming hours. So this is the first part of today's meeting, and you've heard a lot of information that needs digestion. For now, I want to hand over to Nigel Olisa, who is going to moderate our first discussion and round table. And I can see Nigel on screen already. Nigel, are you ready to take over?
Thank you, Yoke. Yes, I am.
Okay.
All right, thank you everyone for joining this meeting today, and also being part of this first roundtable, where we'll be talking about what matters most to patients, involving patients in research prioritization. I'm Nigel Olisa, the Executive Director of GAMIAN Europe. For those who don't know GAMIAN Europe is a pan-European umbrella organization representing and advocating for the interests and rights of persons affected by mental health. Before I kick off with some of the speakers that we have today in our panel, I would like to ask everyone who has joined this meeting today to please send in your questions through the chat box. We have some of our colleagues who will be collecting some of the questions that we will be posing back to the speakers towards the end of their presentation. So I would like to kick off now with Dr. Helen Rochford-Brennan, who is a Global Dementia Ambassador. Helen is currently Vice Chair of the Irish Dementia Working Group. She is currently a member and was formerly chairperson of the European Working Group of People with Dementia and its nominee to the board of Alzheimer Europe. Helen sits on the monitoring committee of Ireland's first national dementia strategy. Throughout Helen's time with these organizations, she has campaigned to raise awareness of dementia through the rights-based approach, including through the media, speaking at international conferences, engaging with pharmaceutical companies, scientists, clinicians, educators, students, and through participation on various research projects, including those focusing on developing evidence-based diagnosis, palliative care, rural isolation, and more recently, living during the COVID lockdown. Helen strongly believes in the primacy of public patient involvement. Helen has received several awards for her advocacy work, including an honorary Doctor of Law degree from the National University of Ireland, Galway, for her work on the rights of people with dementia. Helen, thank you for joining us today. Please, over to you.
Thank you. Thanks, Nigel. Thank you very much for your kind introduction and the honor of addressing you today on patient involvement in brain health and a call to action. Well, there never has been a better time for a call to action than since the pandemic. As I'm sure I don't have to remind you, people with dementia and our aging population were left behind. Our rights were not upheld, and our material citizenship was forgotten about. Just to let you know a little bit about me, I was married to Sean and I'm a mother to Martin. I come from a family of 9. In recent times, I've been living alone as Sean passed away in 2020 during the lockdown. Sean was my biggest supporter, and I know how important it is that I continue my advocacy work to the best of my ability. I continue to live in Tipperary, County Sligo in the northwest of Ireland, and I'm extremely active in my community because public involvement is just not about research in medical terms. Public involvement for people with dementia is very important in the community because we are visible, and that breaks down stigma. In 2012, it was confirmed that I had the brain disease of younger onset Alzheimer's. The diagnosis came after a long, painful period of 5 years, wondering what was the matter with me. There was a degree of relief in getting the diagnosis, as I thought I was losing my mind. I've long since accepted my diagnosis, and this has allowed me to go one step further and find a quality of life for a person living with dementia. This part of my life started once I contacted Trinity College, Dublin, and started getting involved in research. Being involved in research has given me hope and a sense of purpose. People living with dementia can be denied their human rights from the time of diagnosis. We're not always respected and informed. As we live with the disease, we navigate systems and structures which are not person-centered or rights-based. And as a result, either deliberately or by omission, our human rights are denied. To counteract this, people living with dementia must be actively involved in all aspects of the disease. The lived experience must be valued and have the power to influence. But critically, this engagement must be non-tokenistic, come with appropriate supports, and place a value on experts by experience. I'm not an expert in human rights law, but I will tell you I'm an expert in my own experience. I'm an expert in the human rights of Helen Rochford-Brennan. Today, I would like to talk to you about the importance of public involvement and why being involved at an early stage of research process is critical to uphold our human rights and make sure that research is relevant and can actually be used to improve the lives of those intended. Participating in research, when done in a collaborative way, can ensure meaningful and impactful findings are produced. And that is what advocates living with dementia strive for. People with the lived experience should be involved early in the project. It must not be an afterthought. Early involvement is critical, so feedback and opinion can be taken into account. And it is possible to influence decisions and make changes. If we do not have input into decisions, it is not public involvement. Good public involvement has the person setting the question and not answering the question. We are co-producers, we are co-designers. People with different backgrounds and experiences should be involved in setting these research priorities so that they can also bring to discussions issues that may be relevant to them. This could include people living in rural areas, people from minority ethnic groups, gender balance, etc. And this would help to ensure that no one is left behind. Brain health is an issue which affects everyone, and therefore everyone should be involved in research. We are all different, and good research could reflect a diversity of experience. Public involvement does not stop at research projects. We add so much value to research performing organizations through our insights, experience, and heart. My colleagues and I sit on review committees, are members of boards, and help set research priorities in Ireland and further afield. The World Health, who better than those to set the questions? We set the priorities, and so that is important. And I live with this every day, and so my colleagues live with it every day. But we see the experience that those who don't live with dementia and don't see or might not know about. We bring these insights to the table, and that is essential for good governance. We must not leave anybody behind, and we must always remember them when we're participating in research. Involvement is not just ticking a box exercise, and the priorities and issues mentioned by people with lived experience must be listened to and addressed. Public involvement contributors do not simply exist to endorse your opinion or idea. We want to be meaningful contributors, and we want to see the end result. Too often I've participated in a project and never received an update or information on the result. And honestly, it's not good enough. We need to know what has happened to what we've participated in. All too often, public involvement is something necessary for funding or a nice add-on. I hope you avoid this mindset and view us as co-researchers and equal contributors, because after all, we have the experiential knowledge. There are now endless resources and supports for those who want to involve experts by experience in their work. I have been involved in developing many of them. As an advocate, I often remind researchers, we are the only people in the room not paid. We want to be listened to and hope our voices are heard. When we participate in public involvement research and must travel, many of us have experienced great difficulty in reimbursement of our expenses. In the past, I've heard colleagues talk about that they found it difficult to get a bottle of water paid for, and you may all be surprised with that, but that is fact. There's a lot of cost to us, both in terms of energy and financially. We remind research organizations to ensure funding for participant expenses. We want you to ensure that when funding applications are made, that there is a part in that funding application that will cover the experience of the public involvement person. I hope all of you think about how you can involve more stakeholders in research and public involvement work, to hear voices, not just of institutions, organizations and policymakers, but real people. Those real and authentic voices are critical to success. I receive many invitations to participate in research, and I'm glad that my voice is heard. But I challenge all of you to ask yourselves, is listening to people like me the easy option? There are millions of people living with dementia throughout Europe, people living in rural areas with no transport, people living alone with no support to prepare and travel, people who do not use email or who have a visual or hearing impairment and need support with documents, people who live in a country where they do not speak the language and they may have lost their voice. I'm going to say that again. They may have lost their voice. You have the power to support them and to find it again. You need to reach out to those and take practical steps to support diverse voices in research. Find the Helen in your own country and don't take the easy option. Public involvement is about many people, not just consulting with one person with dementia to tick a box. I want to say that it's easy to agree to this in principle, but much harder in practice. Through my work with the European Working Group of People with Dementia and the Irish Dementia Research Advisory Team, I've met some very well-meaning researchers who still do not get it right. You must always be willing to learn, and you must always put those most marginalized at the heart of your work. And then that will achieve great things. For me, it's time to stop thinking that our differences make us superior or inferior to one another. Public matters, public involvement matters, and voices matter. So I'll just end with a quote. Diversity is having a seat at the table. Inclusion is having a voice. And belonging is having that voice heard. Thank you for including the voice of the person today. I'm very grateful for you listening to me.
And thank you very much for your statement. I think a lot of what you have said now resonates with what we also face GAMIAN Europe, with us being the patient organization. We've heard a lot of what you've just said now from our patients. And I think it's about time that a lot of the research are taken into account, and that people, well, actually patients are brought in, at the beginning onset of research projects, and not just brought in to just tick the box and that's it. So thank you for that presentation. There will be a lot of questions coming in afterwards, and for us to have a roundtable debate with the other speakers. Now, I'll just move on to our next panelist, George Stark. So Dr. George Stark is a postdoctoral researcher at the College of Humanities at the École Polytechnique Fédérale de Lausanne. Having recently joined EPL's Intelligent Systems Ethics Group, he currently pursues research on the ongoing integration of natural and artificial intelligence, traceable in the development of intelligent neuroprosthesis. Further to his project, Dr. Stark's research examines the ethics of using artificial intelligence in medicine, with particular attention to neurological and psychiatric applications. Dr. Stark has been trained in medicine and in philosophy, concluding both studies with a prospective doctoral degree. He studied medicine at the Technical University of Munich and acquired clinical experience at the University of Buenos Aires, the Hebrew University, Jerusalem, and the University of Oxford. In his presentation today, George will focus on the ethical challenges of emerging medical technologies, such as digital phenotyping, assistive robotics, personal neurotechnology, brain-computer interfaces, and others. George, thank you for joining us today. Over to you.
Hello and good afternoon, everyone. And thank you very much for the kind introduction, Nigel. I'm delighted to be part of this meeting, since also from an ethical point of view, increasing the involvement of patients in research on brain health is indeed a crucial topic. And in fact, it also resonates strongly with academic developments in my own field, specifically the so-called empirical turn in medical ethics, where large parts of the research community now aim to directly involve relevant stakeholders and specifically patients in their ethical research, using particularly methods from social science, so as to not engage in a kind of detached armchair moral philosophy. So I'm obviously delighted to support this call for action. However, when I was preparing this talk, I was wondering what can I as an ethicist actually add to the debate in this rather short period of 5 minutes. And in the end, I thought that maybe the best support I can offer is to share with you 3 short deliberations, highlighting why also based on fundamental and widely agreed upon ethical principles, patient involvement in brain health is key. Because in fact, even if we go back to the Belmont report from 1979, which is one of the most important documents of research ethics, written in the aftermath of the infamous Tuskegee syphilis experiment, we find that its principles support this call for action, I believe. As many of you will know, the authors of the Belmont report summarized different ethical guidelines for research on human subjects and recommended essentially 3 fundamental ethical principles, namely respect for persons, beneficence, and justice. And I think all of them resonate strongly throughout your call. So the first principle, respect for persons, entails, of course, respecting their autonomy, the old Enlightenment ideal and bedrock principle of medical ethics, meaning that the involved persons should be able to make an informed, autonomous decision. However, if we want to enable patients to act autonomously, it's necessary to have a choice. And this is, of course, also ascertained in current research procedures, but often only by providing patients with a choice to take part in a research project or to not take part in a research project. But would it be a much deeper and more meaningful way to express their autonomy if patients too had a say in which research projects are funded and conducted in the first place? The second principle of the Belmont report, beneficence, is, I believe, also of key importance here. It expresses the idea that research should always heed the maxim, do no harm, while simultaneously aiming for the greatest possible benefit of a research project. But what does count as benefit in such contexts, I think, is a crucial question here. It should be, I believe, what brings about an actual improvement in patients' lives. So putting patient-reported outcome measures to the forefront in the design of clinical trials, as the call suggests, seems indeed crucial if we want to promote a meaningful notion of beneficence. So, in other words, research on neurotechnology and brain health should prioritize patient needs to uphold its Hippocratic ideal, namely to work for the benefit of the sick, to cure them, or at least ameliorate their condition. And the third principle the Belmont report stresses is the ethical principle of justice in research with human subjects. There are, of course, many different and important ways in which justice plays a role in research. For instance, in decisions, who bears the burdens of a research project and who benefits from it. But beyond these kind of classical discussions of justice, there's also a particular form of justice and injustice that I think is really interesting for the context at hand. It's the notion of epistemic justice, or more commonly, epistemic injustice, a concept that has been developed in particular by the philosopher Miranda Fricker. So what Frederica argues is that there's a distinctively epistemic kind of injustice in the sense that it's a wrong done to someone in their capacity as knower, to someone who has a specific kind of knowledge. And a classic example for such epistemic injustice would, for instance, be a situation in which a patient reports pain and is not taken serious by healthcare professionals, resulting in an insufficient treatment of their pain. And to me, this seems to get really to the core of what this call is about, namely that it's a question ultimately of justice, that we take the perspectives of patients who have a unique access to what it's like to be affected by a specific disorder, by a specific brain disorder, seriously, and therefore also involve them closely in research efforts. That's, I believe, already my 5 minutes. So thanks again for having me and for your attention.
Thank you so much, George. I think they will be having a lot of questions coming in for yourself and Helen. We'll just keep on asking the participants to continue to send in all your questions, also for George and Helen, and for the other panelists that will be joining us in follow-up to this event. Our next panelist is Dr. Stefan Schreck. Stefan is an advisor for stakeholder relations in the Public Health Directorate of DG Santé. Prior to that, he was head of the Health Information Unit of DG Sanko. And from February 2016 to November 2020, he was head of DG Santé Unit, Health Program and Chronic Diseases, dealing with policies for all non-communicable diseases, planning and drafting annual work programs of the EU Health Program and contributing to the implementation of the health cluster of the Horizon Europe. Stefan today will highlight some insights on the new European Commission NCD initiative, Healthier Together, with neurology and mental health now being priority areas in the NCD agenda, also now getting more attention at EU level. This presentation will show how the urgency of including brain health on the EU agenda is addressed by DG Santé. Stefan, over to you. Thank you.
Yes, thank you very much, Nigel, and good afternoon, everyone. And thank you very much also for inviting us. This has been already a very interesting meeting so far, I must say. So I will try to contribute a bit with what we are doing on non-communicable diseases in general. As we all know, the non-communicable diseases such as neurological disorders, mental health, cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases and others are responsible for 80% of the disease burden in the European Union, and that's often forgotten in the context of the pandemic. Member states are committed in tackling all of these and reaching the Sustainable Development Goals, and specifically target 3.4 on reducing by 1/3 premature mortality from non-communicable diseases by 2030. To support countries and stakeholders in addressing these challenges, the Commission set up a very successful approach to transfer and replicate best practices on public health. The steering group on promotion and prevention, that's a Commission expert group with representatives from EU member states, has been key to prioritize and transfer activities on the ground, thus for a real benefit of our citizens. The new EU for Health program, with a budget of 5.3 million euros over 7 years, is a key tool for improving EU citizens' health. The program is already proving to be a game changer. At least 20% of its budget should be targeted on health promotion and disease prevention. It's a real paradigm shift for the strong European Health Union we are working now to build. Moreover, the Commission has launched Europe's Beating Cancer Plan. As you know, this major initiative also addresses common risk factors and is therefore an important weapon against other non-communicable diseases such as neurological disorders. Brain cancers, of course, fall under this work area as well. And in the Horizon Europe program, collaborative research on health is notably at the core of the health cluster, which aims at improving and protecting health and well-being of citizens of all ages by generating new knowledge and developing innovative solutions to prevent, diagnose, monitor, treat, and cure diseases. Brain research and innovation, which includes brain health, is therefore an integral part of the health cluster. Besides these important developments, it is nevertheless crucial that we step up our efforts to tackle the huge burden from non-communicable diseases, including neurological disorders. As many as 1/3 of COVID-19 patients are diagnosed with neurological or psychiatric complications within 6 months of being infected with COVID-19. Meanwhile, people with pre-existing mental health or neurological disorders are more vulnerable to the virus itself and to its mental health impact. The virus has also hit people with dementia disproportionately hard. Dementia prevalence in EU citizens over 60 years old increased from 6 million in 2000 to 9 million in 2018 and is estimated to reach 19 million by 2050. In order to address all these challenges, the Commission launched in December last year the Healthier Together EU initiative on non-communicable diseases. The initiative, although focusing on prevention, will develop around 4 components, each of them resulting in concrete actions on the ground. The components are: first, improve knowledge and data; second, promotion and prevention, including screening and early detection; third, optimize diagnosis and treatment; and fourth, the quality of life of patients. And this we will do in 5 strands. These cover 4 main disease domains: cardiovascular diseases, diabetes, chronic respiratory diseases, and mental health and neurological disorders. And then, in addition, there will be a horizontal strand covering health determinants. I would like to stress that addressing health inequalities will also be at the heart of the actions, as well as a patient-centered and integrated approach. The initiative encourages and supports EU countries to implement mental health in all policies and acknowledges the importance of implementing a prevention-oriented approach. As such, the initiative will support EU countries to implement high-impact actions across the entire spectrum, preparing the ground for well-being, promoting mental health and strengthening mental health resilience, preventing ill health, sleep disorders and suicide, providing equitable and timely access to high-quality mental health care, and supporting people with mental health disorders to live their lives as fully as possible by offering integrated support. Major neurological disorders are Alzheimer's disease and other dementias, Parkinson's disease, multiple sclerosis, epilepsy, and headache disorders. In the recent global burden of disease studies, these diseases represent 3% of the worldwide disease burden. A large group of other, mostly rare diseases of genetic origin also cause major neurological problems. These diseases are addressed in EU programs and actions on rare diseases. This initiative is being developed through an innovative and participatory process by discussing detailed priorities and interventions not only with EU countries, but also with stakeholders. By June, we aim to identify the most promising actions to reduce the burden of non-communicable diseases, for EU countries to choose and prioritize, and for EU to support in implementation. It will also map the EU financial and legal tools that will then help to translate those ideas into reality on the ground. And we want to immediately start helping health authorities and stakeholders to work together in teams for the implementation of those initiatives with the support of our own program and possibly also with the support of other programs. We need all stakeholders' engagement. We need your engagement, patient organizations, civil society organizations, health professionals, academia and researchers, and also international organizations such as WHO and OECD. I would like to say also that the next webinar with stakeholders dedicated to the discussion of the initiative, namely the strand on health determinants, will take place on the 3rd of June through the health policy platform, which I hope you know already. And then I would also like to come back to, I said already, the EU is supporting research and innovation through its framework programs. The current Research and Innovation Framework Program, Horizon Europe, is much more oriented to deliver impact for patients, citizens, and society compared to previous programs. The program was developed in a new co-creation process through public consultations and together with member states. Horizon Europe also seeks to develop synergies with other EU programs like EU for Health, but also the Digital Euro programs. In this way, research results can be taken to the next stage and exploited then via another program. Impact-driven research must be informed by what matters most to patients and caregivers. What may be considered important for a scientist may be quite different to what patients or caregivers see as their primary priority. They should therefore also be given an important role during the full process, as Helen described it already, from conception through implementation of research and also uptake of research results. A number of EU-supported projects are aimed at enhancing patient engagement in research. For this to be done in a meaningful way, patients and patient advocates must be well trained in understanding how they can concretely contribute to research. Some training has been successfully established, including via EU funds such as UPATI and Paradigm, both starting with projects funded through the public-private partnership Innovative Medicines Initiative, which is the predecessor of the new Innovative Health Initiative. The EU also supports ERA-Net Neuron, which is a funding platform for neurological and mental disorders, which also organizes together with EFNA educational workshops for patients to become lay reviewers and assessing funding applications for their cause, which was also already mentioned before. We also have some research areas such as rare diseases, which also include rare brain and neurological disorders, where patient representatives are very active partners, leading work packages in projects and initiatives at European and international level. But of course, more needs to be done on patient engagement, and we actually also need to train researchers in understanding how patients, carers, and patient advocates can contribute to research. Looking to calls for collaborative research already launched under Horizon Europe, you will notice that some topics already clearly spell out the need for inclusion of patients or patient organizations to take their views into account. This is a best practice that we intend to pursue in the future. Thank you very much.
Thank you, Stefan, for the overview of the NCD initiative. I think there's still a lot of work to be done by the Commission and all the other stakeholder groups who are involved in the consultation. We'll come back to that. I believe there will be some questions coming in, and there will be also questions for myself, for you, on the initiative. So we'll get back to you on this during the group discussion. Our next speaker is Frederica Destrobek, who is the Executive Director of European Brain Council since October 2014. In his capacity, he is responsible for providing strategic direction and leadership while managing the day-to-day operations of EBC and its ongoing relationships with its member associations and other stakeholders, as well as representing the organization in various European and national forums. Over the last 10 years, the European Brain Council has seen how the overall attitude to patient participation has evolved and how it is essential for shaping the research agenda. Over to you, Fred, to give us some more overview on this.
Okay, thank you, Nigel. Apparently there is an issue. We cannot access to the video, but I just hope you can hear me okay.
Yes, we can hear you, Fred.
Okay, perfect. Well, thank you for the invitation and for having me on this panel. Actually, we were very encouraged to participate in this discussion, particularly as you mentioned, EBC does represent patient organization, but also scientific societies and industry partner jointly advocating for brain research, brain health, and brain innovation. And I would say that I hate to see them being opposed as silo and not being able to interact with each other in agreeing in finding common objectives. And I would like to maybe repeat what Gwendalina was saying in the keynote introduction, that patient engagement in this process requires or is actually building a new culture of participation in healthcare. And it not only makes sense per se, given the huge unmet needs of brain disorders as we know it, and as Orla was repeating earlier today, but also even more so in our space, because brain research and brain innovation are inherently complex. because of a certain number of factors like the lack of biomarkers, issues with clinical scales that actually deserve updates, and the lack of clinical endpoints as well. But yet research is delivering. Innovation is taking up. And we can really say that it is, or actually that the feedback from patients is key in that process. So patient experience, patient relevant outcomes are all factors that are extremely important in that context. And we need a greater recognition of these as we go. So that's the reason why EBC remains committed to supporting meaningful patient involvement. This has been translated in our policy papers on brain innovation, on fostering innovation and improving outcomes paper that was released last year. It was also implemented in the context of projects that EBC contributed to, like Multi-Act. Multi-Act was a project that aimed to increase research impact thanks to the measurement of patient involvement. And last but not least, but this will be also addressed later in the context of the project EBRA, the European Brain Research Area, which is coordinated by EBC. And this project is really looking at avoiding fragmentation and overcoming duplication as it currently exists amongst the large initiatives that support brain research in the context of Horizon Europe. So we have emphasized, of course, all these activities in the context of our contribution to the Healthier Together initiative. And we can probably come back to that later on. I know EFNA, GAMIAN, and Alzheimer Europe also have done so. But I would simply like to conclude by saying that coordination, as we are looking forward to achieving it in the context of EBRA, it can only be achieved through a meaningful patient involvement, and that's probably where the real disruption in research lies. So thank you.
Thank you so much, Fred, for this. I think there's still a lot to be done to make sure that all components are running together. I think now we are just going to go to the questions from the participants. I think we have some questions coming in. But I might just start with a question from myself to all the panelists. So my question to everyone here, so from Helen to Fred, what are the main challenges when it comes to involving patients in research prioritization, and what are the potential solutions? Helen, do you want to start with this?
What are the main challenges?
Yes.
Oh, the main challenges are people with dementia and other brain health issues. I suppose we need support at the time. Another challenge would be that we're making sure that we're supported. That's one of the things that's sometimes forgotten about, is that we really need support to be involved, and so that we can make a genuine contribution. As I said earlier, tokenism happens so easily. So we ask to be careful in planning and consideration, and that if you plan well to include people, then it'll avoid a lot of difficulties for people with brain health. Another solution is a simple one. It's relationship building. Involvement cannot be transactional, as people are given their time and physical and emotional energy. So I want to tell you that I took 2 flights, 2 buses, and 3 trains to join you today. So that is where we use our energy. We're advocates, we want to give our time, but I would honestly also like to say that advocates are not, it's not always easy for people with brain health to become an advocate, because we see the death and destruction along the way. So we're just asking you to, when you're planning, to be careful, to really plan well for us, to make sure that the planning was done well for me today, so I could be with you. And I think that's really important in planning, that we plan early, and to say that we can give, Nigel, we want to give our best. We want to ensure that our voices are heard, and that in the future, it will be a given that we will no longer be talking about public involvement. I was diagnosed 10 years ago with Alzheimer's. In 10 years, nobody talked about advocacy. I was an advocate in my own community. So, and today we're all talking about public involvement, and public involvement is crucial if we're ever going to move away from stigma and see that we can contribute to society. And in that contribution, can I say to all of you on this call today, it gives us a sense of hope and a sense of purpose. And if you're in my shoes, there is no medication for me. So it's important that you remember the contribution that people with brain health are making. But we want to change the world, and we want to be with you and help you to change it too.
Excellent, Helen. I think that's really what I wanted to hear. Stefan?
Yes. Well, I must say that I'm representing DG Santé. We are not financing research. So it would not really be fair to give my opinion, but I can give you my personal impression if you so wish. I do think that a basic challenge is the traditional way research is organized, which is based on the assumption that science is for scientists. And so what we need is cultural change, and indeed not only training the patients, but also the researchers, and they have to really change their attitude. I also think that it's also a generational problem, because I see in the younger researchers, they are very keen on actually discussing and involving with patients. And so I have real hope for the future. And coming maybe back to the implementation of public health policies, I mean, what we are doing is we try to make use of the new knowledge which is created by research. And of course, also there, patients and stakeholders should be fully involved. And in a way, we are having the same kind of problem. There's also a traditional culture of not involving patients enough. And I do think that in recent years, we have already made substantial improvements, at least at European level, where we are in control. But you know that in the European framework, in the treaties, healthcare is a responsibility of member states. And member states are responsible for treating their patients and involving them properly. And we are trying to help them also with that. And at European level, we try to overcome the challenges that we see. One challenge, of course, to mention also that, as you were asking for challenges, is of course the fact that we are dealing with 27 member states. There are very many patient organizations and individual patients who are interested, and it's already a logistical challenge to get all of them involved. But our new health policy platform, for those who do not know it, is really a big help, because we can do virtual meetings and discuss things like the Healthier Together initiative, or the initiative on mental health, for example, we have taken after the COVID-19 pandemic started.
Thank you, Stefan. George, do you have something to add to this?
Little. So to some extent, I feel like the many people on this panel who do all this important work to promote patient involvement actually are much more qualified to answer this question. That being said, I think also the main challenge, very related to what was just raised, really may lie in kind of may lie in overcoming entrenched power structures and existing hierarchies, which may also go back to these kind of issues and generations. And that this may hopefully improve with a younger generation. And then, of course, the solution would be, in many cases, to focus on better education of researchers, of physicians, but also of the general public.
Thank you, George. Fred, EBC being the organization that's kind of bring all three tiers together, so research or scientific research, industry and the patient organizations together. How do you see this playing a role, and how can we make sure that there's this prioritization, that the challenges on patients?
Well, Nigel, actually, I was thinking of these two questions under the aegis of course education, training researchers, training patients being key features here. I mean, there was a very concrete example that, I mean, we contributed to in the context of the training initiatives conducted by EFNA, that traditionally patients were trained by researchers to understand what research or science was. But I was struck by an event that was organized where actually you were training researchers, but by the patients. And this is where this silo breaking I was alluding to earlier is for us extremely important. And this silo breaking for me really means that this recognition of the patient as interlocutor, contributor, but also co-creator is extremely important. And we have demonstrated that in different projects. I was mentioning multi-act together, but I can mention another one on rethinking MS, for instance, where the momentum of COVID-19 really demonstrated the fact that rethinking the governance on how care was organized, but also how research was prioritized, was extremely important, but that from the professionals themselves, they were expecting this dialogue and this meaningful engagement of the patients really to get their feedback and their experience in order to be able to take the decisions of tomorrow as to whether the changes that they had to implement during the COVID-19 crisis needed to remain, or the extent to which they are going to impact the post-COVID-19 era in a treatment of a brain condition.
That's very interesting.
Nigel, Nigel, could I just add something to that, please? You know, we are the people that have the experiential knowledge. We're the people every day that understand the illness and can give 100% of what our day-to-day lives are to researchers. But we expect researchers to be trained themselves, and they can be trained by us, or also they can be trained within whatever field that they work in. But we want them to understand of the many different types there are of, in my case, of dementia, and of many different types of brain health, which I would have had a brain health issue before I had Alzheimer's. And so it's important that we look at training, that I don't need to be trained. And my colleagues, honestly, if they were on this, they would tell you, we are living with this every day. It's our experiential knowledge that you're getting from us. But we need researchers to be trained. And even we can contribute to that. But as I said, we certainly need them to have a better understanding of what brain health is before they come to the table with us.
Great. Luca?
Yes, thank you. I have a question to Dr. Schreck. When you look at the priority areas that member states are presenting to you, and then particularly, of course, to mental health and neurology, do you also, for example, if most countries would say mental health projects need to deserve priority and neurology would be sidelined, would you look at a certain balance in your eventual plans?
Of course, we share with member states our opinion on what a well-balanced implementation would be. Yes, but that said, it is clear that in view of the setup of the European Union in the area of health, member states have to implement whatever we try to do together, which we need full commitment and motivation of member states to actually implement the priorities we agree on together. So therefore, we can try to steer the process, but it is clear that nothing will be achieved if there's no motivation of member states to actually implement it. That's actually also a very important difference to, let's say, other ways of working at international level, to put it like that. So we are not really trying to establish what good policy in specific areas is. That's more the role of WHO, but we try to help those member states which are motivated to implement certain improvements to do this more effectively, together with other member states as a peer group, and supported by European funding and also by European level political support. This is basically our approach. But to be very clear, it will happen only insofar as member states are motivated to implement it. There is no model here where we could tell member states this is the good thing to do, and then member states would do it just because we tell them to do it.
Okay, thank you. That's clear.
Thank you, Stefan. In follow-up to Yoko's question, actually, how is the Commission working with member states to make sure that grassroots stakeholders are contributing to the current consultation of the NCD initiative? Because we have been in contact with some of our local members organizations, so like GAMIAN Europe member organizations, who apparently do not know anything about this. And so how are you sort of working closely with member states to make sure that those NGOs on the ground that are not well known and that have not been part of any research, that they are actually involved in the best practice initiative that is being put together for the NCD initiative?
Well, first of all, I should say that we try to do our best to have proper patient involvement at European level at our end, if you so wish. And on that, as I said, we have established the health policy platform. And this is really an interesting approach. Also, if something new comes up, like now the situation in Ukraine, for example, it helps very much to inform stakeholders and to get them connected with each other. I'm always saying this is our own Sante Facebook there. If anybody has any proposals how we can improve this would be most welcome, because we would like to have this an always improving and learning from experience new system. And if somebody has ideas, please send them to me, and I share that with the colleagues who are in charge of that system. And then we are discussing with member states in the, maybe I can say, traditional way it works in the European Union. Our interlocutors are the governments of member states. And with them, we have the SGPP, the steering group on health promotion and disease prevention, for example. But that's a group only with member states. We, of course, also inform member states about the feedback we receive from patients and other stakeholders at European level. But it is, and we, of course, tell them that ultimately to really have a good system, they need also a dialogue with patients and stakeholders at national level. That's absolutely clear. But again, that is responsibility of member states. What we do hope is that the European level stakeholder organizations and patient organizations, which are our main contact points, would then also provide feedback to their national branches so that they can then talk to their governments. Yeah, so that in a certain sense, this might also be a bottom-up process in the member states. But again, we are not in a position to force member states to have a specific type of engagement with patients and stakeholders at national level. This is maybe I should also mention one new development. You might have heard about the conference on the future of Europe, where 800 citizens were actually selected, not selected, actually. They were just randomly allocated, these 800 slots, to any citizens in the member states. And these 800 citizens have given their opinion on the future of Europe and how things should run differently. And also in the area of health. That is a quite interesting experience, that we have direct engagement with citizens. And that is maybe also something I should mention. It is, of course, very important to engage with patients at our level, but health is everybody's issue. So we should be talking also to all citizens, and we are making efforts to do that. And maybe by talking to citizens in general, we can also improve the link between patient groups, for example, at national level and what is going on at European level. Yeah, because that's our main concern. But again, also on that, if you are having, say, best practices on how to involve patients also at national level, this is also something which we could help member states to implement. We have our best practice portal, and involvement, engagement, and participation of patients can also be subject of a best practice, which can be distributed and implemented in other member states. So if there are good examples, Nigel, for example, if there are some member states which are particularly good, where the government has established new ways of engaging patients and involve them in decision making, then please let us know, and you can submit it to our best practice portal. We would be most grateful for that.
All right. Well, thank you, everyone. I think we're running out of time. Yoki, you have a comment?
Just one last question. Dr. Sheff, thank you very much. I really appreciate all your advice in this matter, but I have one burning question. It looks as if in order to get the plan ready on June the 22nd, I think it is, there's going to be a possibility for more input, and we play that through the member states. Now, who would be, in your opinion, the best layer within those states to contact? Is it the minister? Is it the...
Yes, I need to unmute myself. Yes, indeed. So the key contact point for us is the ministries of health. And obviously, if you want to talk about research, then you have to talk to the ministries of research, because that is our both formally, but also in terms of frequency of contacts, that is our main interlocutor. So if indeed you want to influence what happens at member states level, talk to the Ministry of Health, because they are the ones which give the opinion of their member state a voice in our meetings, and that applies not only to us in the Commission, but that applies also to Council. It's the Ministries of Health usually which are represented in the Health Working Party of Council when we are talking about something which is more legislative, for example.
Thank you very much.
All right, thank you, everyone. It's a pity that we don't have enough time, because there are a couple of questions that are just coming in now that I'm just saying. But we have to move on to the second round table and not delay too much. Helen, thank you very much for coming and for all the powerful statements and speech that you've given. I think it resonates quite a lot with every one of us. So we will take that forward, and hopefully we'll continue to make sure that the patient's voice is heard and that that patients are brought forward first. Stefan, thank you very much for the giving us an overview of the NCD initiative and more information that we needed to be able to feed back to all our member organizations on grassroots level. I think a lot still needs to be put forward to make sure that the patient voice is heard from the ground. George, thank you very much for your intervention. I think it's wonderful. It's great to have you here. And there were a couple of questions that just came in for you, but it's a pity that we don't have time to throw it at you, but hopefully you're able to respond to some of the questions that have been posed by AISM. Fred, I think he has disappeared. I'm not sure where he is, but
no, I'm still there.
Okay, Fred, thanks for being here and for your contribution. I'm sure everyone else here in this group will continue to contribute to the ongoing discussion. Thanks, everyone, and have a lovely afternoon.
Thank you, Nigel.
Yeah.
Thank you, Nigel. I think it's also my turn to thank you for the fantastic moderation that you have made. So it's been a pleasure listening to the discussions that you've moderated so far. So you've really set the bar very high for our second roundtable, but I'm very confident that the second roundtable will be just as interesting, because the kind of speakers that I'm going to be able to introduce are all real experts in their field as well. So we've listed, so first of all, my name is Jean-Georges, I'm the director of Alzheimer Europe, and I'm delighted to moderate this second roundtable. So in the first one, we heard very much on how can we involve patients, why should we involve patients, and what would be the priorities that patients would have when it comes to research, healthcare, and policy. And the second roundtable is hopefully going to be focused very much on, well, now that we know that we should engage patients in all of these kind of discussions and decisions, how can we maybe improve the way in which we involve them? And just as in the first roundtable, we'll have an expert by experience who will be introducing the topic.
Next door.
will be introducing the topic, and then afterwards we'll have 3 more speakers to make some shorter contributions to the general discussions. So my first speaker that I'm going to be introducing is Eric van der Eycken. He's, as I said, an expert by experience in the field of mental health. He represents the patient's perspective in EU-funded research, mental health-related projects, and he acts as a liaison between GAMIAN Europe and its members. In Belgium, he is also a board member of a patient organization which is called Ups and Downs, and he's also active in various governmental advisory bodies. He holds the position of independent director on the board of a psychiatric hospital in Geel, a smaller place in Belgium, which is well known worldwide for its unique mental health community care. And before he joined GAMIAN Europe, he had a career in the automotive industry and more specifically in the R&D area. So he has a really interesting bio and CV, and he's going to be the one that will be introducing the topic on how we can improve the way we involve patients in brain health. Over to you, Eric.
Thank you very much, Jean-Georges. I wanted to share my screen. For the moment, I'm probably apparently disabled. So don't know what's happening. So the host has disabled my screen sharing. So I will, okay, I will proceed to continue then if this problem can be solved. Okay, there we go. Thank you very much. So we have this one. Okay, I hope you see my screen now. Okay. Good, thank you very much. Good afternoon, everybody, and thank you very much for having invited me to have an introduction talk for this second roundtable discussion. So I'm very delighted to be here, and I would like to start to say that and to show you an overview of a few EU-funded research projects, mainly Horizon 2020, that GAMIAN Europe has been participating in or still is as one of the consortium partners. As you can see, I go back to 2011 with the Roma project that finished in 2014 and where GAMIAN was already involved, but not yet as an official partner. Now, most of these projects, the majority of the project partners in these projects, they come from academia, some from the industry-related domain, and sometimes one or two, sometimes two patient organizations. But just to tell you that beyond these EU-funded projects, GAMIAN is also contributing to other projects, research projects run by companies active in mental health, as well as we initiate from time to time ourselves some projects with external funding. Good. You can see that throughout this time span of, let's say, about 10 years, the degree of patient involvement as a patient organization has increased from dissemination activities to what I would say a true co-creation tasks. But as you might notice, this increase is not linear in time, but is of course depending on the nature of the project and nature of the research activities. Now, in my personal opinion, a patient organization, especially in the first years of this time span, was often taken on board because of EU demand to include patients' engagement for grant conditions, especially, I say, in the first years of this time span. But now I dare to say that we are taking a bit more serious, and we are on the way to become a recognized and a true partner to include the patient voice, the patient perspective. Now, giving input on accessibility to therapies or friendliness of or acceptability of monitoring apps are just a few examples of our patient involvement. And these type of activities at GAMIAN Europe are most of the time run by patient advisory boards, as well as we have created specific teams of patient experts, expert by experience from our member organizations in the different or from the different EU countries. Now, let me now take you to a presentation that you might probably not expect in this event about brain health research. A person with lived experience for more than 25 years and be an expert by experience in mental health the past 15 years, I combine my experience in automotive and knowledge in automotive. I can combine that with the one in brain and mental health research. The reason why I present this in this way is the fact that I suppose most of the webinar participants, they do drive a car, but I suppose not many of them at this moment here attending are patient experts. So it could be that we have a different understanding of what patient involvement is. And in my presentation, you will see later, I also want to show concrete challenges in the field of research and practical actions really from the ground that have to be taken for improvement of patient involvement. And this is the reason why I show this presentation. There are many parallels between automotive R&D, automotive research, with the aim to get the right car for the customer, and the research in brain health to get the right care, the right healthcare for the patient and his carer. By the way, in the following of the study, just take notice that I'm focusing on one hand, the customer representative, and on the other hand, the patient experts, which is in fact the equivalent in the brain health care research. Sorry. Okay, let us take off with the basic research in both worlds of driving cars versus brain health care. I do not expect that the car drivers under us, among us, that they understand all properties of the materials, such as mechanical strength, elasticity, chemical reactions, or other physical phenomena in new fuel cell technologies. But don't worry, I don't know much about what is mentioned in the right column with the terms in the basic brain health research. But you could say, you could ask yourself, is this knowledge necessary in order to buy the right car for yourself? If I look to the objectives and the motivations of this type of activities in basic research, I would say, no, it's not necessary. But what about basic research in brain health? Does the patient or the patient expert, does he have to know what all these terms mean? Something to think about, but I personally don't think so. So this about basic research. But let's now compare another research stage or another R&D stage in car development. Suppose, or as an example, the design process. I cannot assume, or I would say, I put rather the question, can I assume that you don't know what the best drag coefficient of an NVH level is for your favorite design? Design engineers, well, they will, in this case, find out for you in laboratory conditions, say, for instance, a wind tunnel. Am I, as a patient, interested in the neurochemical process in the labs? Do I know what profile is, for instance, best for my mental health? The story of the questions and the answers about the design gets different if the designer knows for what type of customer he has to create his sketches. If he is aware of the preferences and the needs of the specific customer who will buy the car with his design, he can fill in the technical specifications as shown in the previous slide. So, but in order to do this, and I think there comes in the patient expert, or in this case, the customer representative, he is involved, he has the questions, and he has the knowledge about the customer needs and the preferences. The question arises then whether the patient expert has to be involved at this stage of brain health research. But maybe it might be useful for him to know what is related to his mental health conditions to give some input if it is needed. Okay, in fact, I can continue with this story for different phases in the research process. You want to know what Euro emission levels your car can achieve, what technical requirements are to be fulfilled, and so on, for a front-wheel drive, all-wheel drive, and so on and so on. So, but is it really needed that we, as driver, understand all these things? How the combustion process is in a diesel-powered car, or how the electrical transfer system is developed in a new electrical car? Here again, I don't think so. But what does it mean for me when I choose a car? How is it driving a diesel-powered car? How is it driving an electric car? So what about the scores in the same way for measurement of depression severity? What does that mean for me as a patient? Good. Here again, the story changes when your needs as a driver are expressed in understandable language. So you are interested how fast your car can drive on the German Autobahn. You are interested if it is safe to overtake a truck, that you have sufficient acceleration performance. So what about the voice of the patient by patient representative in this process of brain health? Do we need this voice? Will it be heard in the same way as a customer representative gives his voice of the customer? Now, interesting to see, and then I come to, let's say, something comparable with clinical trials. It's interesting to see that driving experience with driving tests will lead to some further re-engineering, some further, let's say, customizing the research on the car to different characteristics which are really important for the future car owner. And engineers, and that's important, they will sit together with customer representatives or with patients to discuss these topics and to improve the driving quality and the comfort of the passengers of the new car model. And this is similar when we talk about clinical trials. The researcher should take time to discuss and then take into the considerations the feedback from patient experts representing the patients and the carers. What do you think about patient-reported outcomes? What do you think about patient-reported experiences? What does that say about real-life quality of a person with a brain health disease? I could keep on going with the importance of customers and patient involvement when research documents are written, published, and shared, among others. Important is to know what is important for, what is relevant for the patients. So I think finally I come to the slide where everybody is waiting for, the challenges ahead of us and the actions to be taken to improve patient involvement in brain and mental health research. These are now so easy, I would say, to derive from what I have been telling in the other R&D area in our lives, to drive, to create, to find the right car for us as a customer, and for not to forget also the regular passengers, or in this case, the carers. So you see, I've put here a lot of, let's say, challenges. I could go from one to another, but I suppose these presentations will be shared later on with the webinar attendees. And I think also my introduction talk is long enough I hope it will be clear that with the comparison that I made with automotive industry, automotive research, it is quite clear that the customer has to be involved in the research by a customer representative, as such as patients can be represented by patient representatives. I thank you for this listening.
Thank you so much, Eric, for this really insightful presentation. I have to say, when I introduced you and said that you had a past in the automotive industry, I wasn't aware that you would make such a fantastic analogy between the work that you've done in that industry and with the kind of patient involvement. So I thought that was very thought-provoking. But I also take from your presentation that over the time, as you've seen patient involvement develop, that from simply being partners in dissemination activities, we are now much more involved, and that over time that has changed and improved. So a lot of food for thoughts, and I look forward to the questions that people will have. So just a reminder to everybody, any kind of questions that you have, please ask them in the chat, and I will make sure that after all the presentations, we will have some time for discussions. And I'm very happy that the next presenter that I have here today is Alex Adius Saliba he is from Malta. He was first elected as a member of the European Parliament in 2019. Before that, he graduated as a lawyer and worked as a journalist, as well as a legal advisor to a number of Maltese ministers. He currently serves on the Internal Market and Consumer Protection Committee and is the vice chairperson of the Petitions Committee. And especially in his role as vice chair of the Petitions Committee, he was appointed as a special representative for his political group for the framework on people with disabilities, but he also serves as a co-chair of the MEP Alliance for Mental Health that is coordinated by GAMIAN Europe, and he has supported the push for the EU focus on greater prevention of mental health problems, including calling for a European mental health strategy. Alex, we're delighted that you are able to join us today, and we look forward to hearing your thoughts about patient involvement in brain health. Over to you.
Your thoughts about patient involvement in brain health. Over to you.
So thanks a lot, Eric. It's a privilege for me and an honor also to be here, also addressing and being part of this wonderful panel that you have today. In your introductory remarks, Eric, you said that you have a panel of experts. I'm not an expert when it comes to mental health, brain health, but at the same time, I was always vocal from my election in the European Parliament way back in 2019 on mental health issues and also brain health issues. And definitely this is one of my priorities when it comes to advocacy at EU level. And for me, this is a priority because the fundamental question when we discuss these issues of mental health and mental health conditions, we have to keep in mind that these conditions amount between 22 to 25% of the EU issues dealing specifically with disability issues. And fortunately, good mental health is increasingly also being recognized as an important factor for economic growth and also social development. But despite of this recognition, there is still lack of adequate mental health services and also lack of adequate support services throughout all our European Union. For me, to develop an appropriate and also a relevant mental health services and support the direct involvement of patients should be seen as one of the most crucial elements in this whole process. Crucial not only to increase the impact of treatment and health outcomes for patients themselves at an individual level, but also to improve and better tailor our health services for our patients. In other words, patient involvement can help to ensure that our health systems deliver in terms of patients' expectations and also patients' preferences. For me, patient involvement directly relates to patient empowerment. Patient empowerment helps people to gain control over their own lives and also increases their capacity to act on issues that they themselves define to be important. Involving and also empowering patients and people to recognize their vital role in the management of their treatment, of their care, in true partnership with health professionals and also other care providers. It is heartening to see that the notion and also the need for patients' empowerment is being increasingly accepted. However, this is mainly the case for persons affected by physical health conditions. For those living with mental ill health, there are still many examples of disempowering attitudes and also disempowering behaviors in healthcare, in education, and also in our society at large. Stigma continues to be attached to mental health conditions, much less so to physical health issues. And this can be a barrier to self-management and also a barrier to patient involvement. In many situations, the capacity of people living with a mental health condition to effectively self-manage their care and treatment is being questioned. However, I do not agree with this. I say that patients should be involved with the treatment and care decisions that affect them as a matter of course. This will ensure that patient-centeredness as well as treatment relevance. It will ensure more effective treatment, more effective care, and this will contribute to also sustainable health systems and also sustainability when it comes to budgeting. And last but not least, it will also help increase the self-confidence and also facilitate the integration of patients. So what we can do as MEPs, as politicians at the EU level. First of all, I believe that we should advocate the notion of patients' involvement in all our work and also in all our deliberations when we're dealing with mental health issues, both directly and also indirectly. Secondly, I believe that we should advocate for health systems which aim to keep patients in the community to the largest possible extent. For systems that support patients in decision-making processes and aim for least restrictive treatment and also care alternatives. For strong and accessible community-based services. For systems that support human rights, as well as the capacity of patients to manage their own conditions. Third, I believe that we should champion the recognition of peer support as beneficial to our patients. We should support organizations to build capacity and also support their efforts to amplify the voice of patients and also the voice of their carers. As a co-chair of the MEP Alliance for Mental Health, I am happy to be actively advocating for a European Year for Mental Health as a stepping stone towards a more comprehensive EU mental health strategy. Moreover, our political group, the S&D family, of which I am also a vice chair, has issued a strategy on mental health, which is very much in line with what I am saying today in this meeting when it comes to patient-centeredness, when it comes to treatment relevance. You can rely on me to continue with these efforts as I see patients as a resource in developing better and also to fulfill a more fitting healthcare delivery. Empowering patients will ensure the best possible use of the resources that we already have at hand and put them at the very heart of care provision where actually they belong and should always belong. Thanks a lot.
Thanks so much for this really impassioned and very clear speech. It's fantastic to have allies within the European Parliament that are so dedicated to our cause. And I think we've heard a lot during this session and this meeting around patient involvement in research. I think you reminded us about the very important question of patient empowerment, and patient empowerment for that to really be able to work. You need to overcome stigma, but you really need to make sure to involve patients then in healthcare, in education, peer support, in the definition of community-based services, and a lot of the questions that you've mentioned. And it's great to hear as well that you feel that you want to commit members of the European Parliament to make sure that they involve patients more proactively in policy discussions that affect them. So fantastic to hear from you. Again, I want to remind everybody that if you have any kind of questions, please use the chat to ask those. And now I can move on to the next speaker, and it gives me really great pleasure to introduce Nathalie Baer. She has been working with the European Medicines Agency since 1998, and she's currently responsible for its engagement with patients and consumers. And over the years, Nathalie has been testing and implementing various methodologies to include the patient's voice in all aspects of the regulatory life cycle of a medicine. And as a steady increase in patient engagement at EMA has been observed, Nathalie continues to further strengthen and diversify these activities to ensure they are fit for purpose in an evolving health landscape. And Natalie holds a Master in Public Health and a Bachelor of Science in Psychology. So a really good background to really participate in these discussions and let us know how the European Medicines Agency involves patients in the regulatory system. Natalie, it's a great pleasure to listen to you.
Thank you very much for the introduction, Jean, and good afternoon, everyone. So I've just a few slides to show you. So I shall try to share my screen and hopefully it will work. Okay. Okay, can you see? Yeah.
We can.
Okay, so great. So I won't spend too long. I know time is tight, but just an overview of how we engage patients at EMA. And just to say that for us, engagement is also involvement. So it does make a difference and it does have an impact. I think there's some different interpretation of the definitions. So EMA, the European regulatory body, which is responsible in a nutshell for assessing and monitoring medicines across Europe. Just to show you here the centralized procedure. So this is where pharmaceutical companies, when they have developed their medicine, if they want to have an approval for these conditions here, they have to come to the EMA for this approval. If they get it, then automatically it's valid in all EU member states. So just to highlight that. So in terms of how patients are involved in EMA, and this is something we've developed over many years together with the patient community, testing, and as we heard earlier, implementing the various methodologies. So they are currently voting members of our management board and of some of our scientific committees representing the whole patient community. They're also representing their organization in our Patients and Consumers Working Party, which is made up of several patient organizations. Also, we send out various different consultations on a whole range of activities or new policies, things we're doing to organizations to get their input, and we invite them also to workshops if it's an area they're interested in. And also, interestingly and importantly, individual patient experts are then involved in the individual medicines assessment. And this is kind of in different places along this medicine's life cycle, from right before the companies even submit when they're developing the plans. They can come to EMA for scientific advice. EMA patients participate there. Then during the assessment of the medicines, we might hold an expert meeting. They may come to the committee, or they may just review the documents, but all these different activities for those individual patients with experience of the condition to come and get involved and share their perspectives with us. This is just showing our patient community. Without them, we would not be able to have any of the involvement that we've had. So we're very grateful for all of the work that they've done. As you can see here, of course, EFNA, Alzheimer Europe, and GAMIAN are one of our what we call eligible organizations and are listed on our website and part of the Patients and Consumers Working Party. But also individual patients can also register with the EMA. They can register to get involved, or they can just register to receive information from us in targeted areas. Now, what we've found along the way is that to enable really efficient and good interactions and involvement, there's two kind of sides to it. On the one hand, we need to have a flexible range of methodologies to be able to gather those insights from patients that then complements the scientific data. So it might be a face-to-face small meeting. They may come in front of the committee. Perhaps they prefer to give us feedback in writing, or we would do a survey to the whole community. But on the other side, and really importantly, we have to make sure that we provide appropriate support and training, because without that, patients aren't going to be able to participate in a way that is conducive to allow them really to share those aspects. It is quite technical discussions, so it's up to us to make sure that they are fully supported, understand what their role is, what EMA is discussing. And again, there's a different range of ways that patients prefer to either read something, to watch a video, or to have this one-to-one support by telephone. So also just to give some examples, so you can see here on the table in the right, I just took some of the kind of areas that we're talking about today and the different ways they've been involved over the years, whether it was an expert meeting, whether it was reviewing a package leaflet or a document, or the scientific advice procedures I mentioned earlier. Importantly as well, and we heard this earlier about making sure that engagement is not just a tick box, it's taking up a lot of time for everybody. So it's important for us to understand it was making a difference. And so we've just finished a 3-year survey where we looked at patients involved in the scientific advice procedures, and we got impact from those involved, from the regulators, but also the assessors and the patients themselves. And the data showed that over half of the cases when patients were involved in those discussions, it led to specific discussions, further reflection on something that they had mentioned. And 20% of the cases of something the patients had said made a change to then the advice that was given at the end, so the final document. And also it's important to say that over 85% of patients also actually agreed with the development plan that was under discussion, the type of clinical trial, for example. So it doesn't mean that patients would necessarily need to disagree with something for it to be an impact. So this is, I've put the link here, it's published. This is really great for us to be able to see it does make a difference, and it's not just a tick box. And also another example recently was the assessment of Aduhelm, which was intended for Alzheimer's disease. And this is where we had patients involved in an expert meeting, which was convened by the committee, a small discussion meeting, and we had patients participating there. And it was really valuable, the insights and their opinions and views on this medicine and the data that they shared then with this group. And actually the statements that they had made were then further shared with the whole committee who were looking at this medicine, because it was so insightful for them to be able to hear this. So busy slide, but really I just wanted you to have the slide. This is just to show as well that there's a lot going on in the clinical trial area across Europe. The clinical trial regulation has recently been revised, and it's really about harmonizing trials across Europe, a much more transparency, making it a lot easier for patients to see which are the recruiting trials, what are the data coming out of trials already finished, and of course safety. There's the ACT EU initiative, which is hoping to transform the research environment. Darwin EU, which is going to be this network of bringing those experts together. And just to say as well that patients are involved in all of those things. They're on the Darwin Advisory Board, the Big Data Steering Group. They're going to be on the platform of ACT EU. There are a lot of consultations on all of these things happening at PCWP as well. Patient organizations are empowering themselves as well, doing their own registries, their own data platforms, all of these kind of things. So this is where I think we all need to really work together, share that information. Patients have information that isn't gathered during a clinical trial. The clinical trial has their biological, that kind of scientific aspects. We need to make sure that it's all together in one place when we're making these assessments and decisions, so that we can come out with more patient relevant outcomes. And looking ahead, making sure we keep advancing. There's a lot of new digital real world evidence, all these kind of things are coming up. So we need to keep up with the times and make sure. And also we need to enrich training and support. And we were advised by Alzheimer's Europe as well recently that what we thought was a good adaptability wasn't good enough. And that was good because it helped us understand, and we can adapt as well. So, it's about working together. So I'll stop there because I'm sure my time is up, but thank you.
Thanks so much, Natalie, for this really important and useful overview. I think there's very few European agencies or European institutions that have such a well thought through idea of what public and patient involvement really means. And it's something that you live on a daily basis, and really that's not something that can be said about a lot of other agencies and companies. And as you just said, we had the privilege of being invited to an expert meeting, and it was fantastic to see how receptive you were with suggestions that we had on how that could be even further improved. So a big thank you both for the presentation and also for that specific interaction that we as Alzheimer Europe had with the European Medicines Agency. And then our next and final speaker for this session is Monica Di Luca. She has been a professor of pharmacology at the University of Milan since 1999. Her primary research interest is related to brain and synaptic plasticity, with the primary aim, of course, to apply these basic findings to the cure of neurodegenerative diseases such as Alzheimer's disease, amongst other. But very importantly, she's very committed to sharing ideas across borders and establishing collaborative multi-stakeholder networks bringing together scientists, clinicians, but also patient organizations. And she has served as a member of council of several national and international scientific organizations. And she's the former president of FENS, which is the Federation of European Neuroscience Societies. And Monica, we're all ears to listen to your ideas about patient involvement and how to further improve that. Over to you.
Thank you very much, Jean. This is being the last is very challenging because a lot of things has been said, but also gave me the possibility to think a little bit more and to add some few thoughts on my speech. I will use my 5 minutes, and I would like to immediately say that it's a privilege to bring the voice of scientists in this platform. It's very important. And I would like immediately to connect to what Gwendolina was saying in her keynotes in the first part, because I really believe that scientists now, basic scientists, are engaged, are equally engaged as patients and hopefully as clinicians, but certainly scientists are. We learned the lesson. And also I hope that I can also bring some points from Eric's lecture, very interesting, on the fact that whether a patient would like to know or not to know what we are doing in terms of brain health on basic and fundamental research. My answer immediate to this question is yes. Me as a scientist, I would like to be confronted with the patient, also in doing so. But let's start from brain research. Basic research is still a player in this scenario, very important, because we know that it's still fundamental for us to achieve our ambitious goal to achieve brain health. This is what we are disputing in these days. And we know also that our field is very rapidly evolving. It's been always at the forefront of science. But as basic scientists, we know very well that an intense research is still needed to achieve a complete understanding of the brain. That's why basic science in health condition, in physiological condition, but also to understand the complex functioning or dysfunction of the brain in different brain disorders, in different mental and neurological dysfunction. So it is still, it is absolutely useless to say to this audience that brain disorders still represent a challenge, or I prefer to say the grand challenge for our future. We know the cost, we know the numbers, Orla already mentioned this. This is absolutely incredible. But we as basic scientists, we really learn how, very rapidly I must say, the lesson that we need to orient our research to respond to this grand challenge. So for us, it's very clear that there is no good science, there is no bad science. Excellent science is a science that is curiosity driven, but is also ready to respond to a challenge from the society. So we need to be open to the society. And we learn how to work together, how to communicate to the civil society, how to be confronted to the civil society need, and what is important, how to capitalize on our results to foster the level of innovation. And this is a point that was not touched, but the level of innovation is poor in our field. And we really need to bring forward this very much. So basic research is still needed. Breakthrough discovery can come out from our basic research. And working together, scientists and civil society can certainly accelerate the translation of breakthrough research into the relevant clinical application. And in this respect, I really, I don't know whether I disagree with Eric, but I really think that a confrontation between scientists and civil society, also on principle of fundamental research, basic research, not disease-driven, but simply curiosity-driven is important, because you never know how a breakthrough can come out and how a need can be solved to a certain direction. So again, I believe that scientists, maybe as group or individuals, learn how to work together and how to be confronted. And I don't know how to say, we improved this already through many different ways and approaches. But I would like also to give you another example and to put into the discussion, because I also saw some points in the chat very interesting. That is to say, to touch a different level and how scientists can interact and engage with the civil society also in the frame of policy of science. So I would like to mention EBRA, the European Brain Research Area project that is led by the European Brain Council, but is a very important project because it brings together at the same table all the major stakeholders and founders for neuroscience in Europe. So we are working together with JPND, with ERANET Neuron, that is working very well, both are working excellently, and eBrains that comes into the scenario and again give an excellent contribution. So altogether we generated EBRA with a clear aim to avoid duplication, to fix shared priorities, to avoid the fragmentation in the area, and to foster this typical translation between basic science and application and innovation. And this was very clear in the aim of this project. So I would like to say that patients' organization and the civil society has been embedded in EBRA since the very beginning. So all the patients' organizations that are here today participated to our boards. GAMIAN and EFNA are participating to the decision-making bodies of EBRA. So they collaborated, all the civil society is really collaborating to structure the strategy of this project. That to me is a very important point because they collaborate in writing, they collaborate in shaping the goals and in shaping the strategy. There are many practical ways in which I must say EBRA is achieving or improving the way scientists, clinicians, and civil society can work together. I would like to mention one aspect, for example, that was a very practical one, which was an excellent experience within EBRA and within ABC. I must say we collaborated with MultiAct, that is a brilliant European project that was coordinated by the Italian Federation of Multiple Sclerosis, that had the goal of achieving a responsible participation and a novel governance model to improve healthcare. And we embedded the principle of MultiAct for this novel experience of patients' engagement also in the governance model inside EBRA, putting these tools that were deriving from MultiAct in contact with the community of EBRA, that was patients, that was scientists and clinicians all together. But another key aspect that I would like to mention in these few minutes is SEBRA. SEBRA is one of the main goals of EBRA, of this project, and is to achieve a shared European strategic research agenda, just putting together the input coming from all the funding agencies, but also coming from the community. There is a comment on SEBRA in the chat, and I would like to raise some aspect of SEBRA before answering. So in my opinion, this was really one of the best achievements of this project altogether. And SEBRA is already out there for a public consultation, that has been mentioned by Sigrid Gils. I would like to say that in my vision, SEBRA can really draft the future or pave the way for the future research strategy in neuroscience in Europe. And this is really sharing because everybody contributed to this agenda, and patient representative, everybody, including GAMIAN, EFNA, including Alzheimer Europe, all these representatives were sitting together with clinicians, with scientists, with industry representatives to shape this agenda. So everything was equally embedded with an equal opportunity to bring and to put on the table their own priorities in a true co-creation process. So I really would like to mention SEBRA as an example of co-creation, spontaneous co-creation that was really completely engaging the different actors in Europe that have an interest in brain research and in brain health. So in that respect, I have to say that I'm sorry that maybe reading the document, and I'm trying to answer to Sigrid, it was not immediately clear how much the patients were embedded since the first step of the creation of this agenda, but they were. And patient engagement was one of the key messages that is in the introductory note of this document. So to me, this was really an experience in which we ameliorated even more the way we incorporate the patient's opinion, the priorities of the patients and the need of the patients, also in the design of basic research priorities for the future. And this was an incredible experience. Last but not least, what we learn as basic scientists is to educate the next generation. And this is an important aspect that has been already put forward. I know that patients' organizations are even doing better because they generate a young patient advocate that can be trained to advocate for brain health and for their own priorities. What we are doing from our side is engaging our new colleagues. The next generation of neuroscientists is fully trained to this process of co-creation of our priorities and simply to confront our ideas with the civil society. And with this, I would like to stop and to give back the floor to you guys.
Thanks so much, Monica, also for this. I think we've heard from all our speakers now, and I think we can maybe bring them all together because there may be questions from the floor, although I didn't see any questions during this session. But maybe I think also, Monica, what we heard from you is really this importance of not just involving patients in research, but really in research strategies, in research settings, in policies, and also in anything advocating on behalf of the research community on how research should be funded. So I thought all of that was very interesting. Maybe if I had one question to ask, because this was a session that we should also have talked about improving that involvement and empowerment of patients. And maybe if all three of you could just basically, what's the one thing that you would maybe change to further improve that patient empowerment and patient engagement? And maybe starting with you, Eric.
Yeah, I would say, and I'm always talking from grassroots level. What is so important, and I try to stress that or give that focus on that, is the language that is used. And I mean not only the native language or the language of the person, because we are talking now about a European organization. So we are talking on European level now, and I have the same issue with GAMIAN Europe when we talk with member organizations, and we really want to go to patients and their empowerment and their input. Sometimes there is a language barrier. That's language barrier. On one hand, okay, we have Europe, we have 30 languages, but especially when we're talking about mental or brain health diseases, this is so sensitive that you can use your own language. That's one. So if there is some means to improve this way of communication, this would be a very big benefit. And the second one is still about communication, because it's all about communication to my point of view, is also the language that we use between scientists, researchers, and the patient experts. Also there, I think communication and training each other of how to understand each other, how to listen to each other, and how to speak to each other, that we all understand what the point is and what empowerment is and what can help, what cannot help, what the outcome has to be. So for me, communication in all these aspects is very important between all stakeholders.
Fantastic. Over to Natalie.
Thank you. Yeah, I mean, I think it's across the board as well, trying to make engagement systematic. I mean, I think we've heard it's increased a lot and, you know, it's happening a lot, but I think there's still gaps. So I think we really need to look at where those gaps are and just make sure it's systematic engagement. It should be just, you know, part of everyday work for everyone involved. I think that there's probably a lot of good to be through sharing, like when something's worked well, to share it. And I'm not just saying because we, you know, we have some good examples, but we can also, you know, we've done certain things, but you know, there's other things we haven't done. And so I think if we all share, like when we've, you know, piloted things and worked through things. And finally, I think even when you have things set in place, don't always assume that they're going to be continually fit for purpose. And I think we've seen you have to always just make sure all the time that, you know, okay, does it need further improvement? You know, it worked last year, but does it still work the same this year, and that kind of thing. So I think those would be my messages. Thank you.
Great. And then Monica as well.
Yeah, thank you. I think this is a very important point. In my opinion, one turning point is the engagement of patients in the policy process, discussing the agendas. That has been a change for me. And this is not engaging, as Eric was saying, during our, you know, European project in which we have been somehow forced at the beginning to put the patients' organization and to confront with the results. This is deciding together. So which is the direction we have to take? In SEBRA, we did it. It was a great experience. The voice was equal. I mean, scientists, patients, other actors, same level. So that to me is an instrument that we need to use. And this is the first point. And the second instrument for me is very clearly is education of the next generation. And here comes the language that Eric was saying. We are implementing in Italy a higher education plan in which we would like to involve patients using our own language for that part. So discussing patient towards young scientists altogether, maybe young patients as well. That is very important also for them. So creating an advocacy plan also locally through the education of the next generation. For me, these are two important points that maybe needs improvement.
Thank you to all three speakers there. I think there was one question still also for Monica around the question of Zebra. And could we ask Monica if Zebra is open and to state that it is the opportunity for people to set the research agenda? So maybe if you could highlight some of that.
There is an open consultation. Zebra is open, is out there exactly because the community at large, the civil society at large can comment and can give inputs. And then we will incorporate in the second version of this document so that we will have also the voice of the society inside. Absolutely, yes.
Thank you so much. And I've realized that I was a bit jealous of Nigel because he had a fantastic panel of people that were making fantastic discussions and presentations. After having listened to you, I've been very, very happy and been very fortunate to moderate such a really interesting panel as well. So a big thank you to all three of you, but also to our member of the European Parliament for really insightful ideas. I think as the three organizations that came together to really promote this idea of patient engagement, patient empowerment, I think we were able to identify the right speakers for this. And maybe just one last question, because all three of you, you are passionate and believers in this, but there's not everybody in your field that is a believer. And how can you convince somebody that may be a bit more reluctant about or also having to engage patient, and it's a lot of work and it's complicated and it's not that easy? How, if you have one message to them, how do you make sure that you can convince them? And maybe starting again with Eric.
I would say if you you can convince a person just by saying it could have been you or it could have been your family that has to be cared of. Do it for not only for yourself, but do it for other people, for the society. I think that's a very important one. If I look to the community of peers, if I compare my previous career and the career now, I've never had such a good colleagues as my peers, because we're doing it for other people, we do it for our peers. And I think that's the big message that you can convince people. Yeah.
Thanks for that. Natalie, how do you go about convincing other regulators, or are all regulators fully on board with patient engagement already?
Yeah, no, and it has been a journey, but I think it's about, well, on the one hand, showing that it can make a difference, and that, you know, it's complementary information, and it's, you know, it's going to be useful, but equally as well, saying let's go step by step. I think people were less worried when we said, okay, let's just do a pilot, let's do it step by step, work together, and then and that kind of worked in that way, so they're less frightened in that way.
Monica, how do you go about convincing all your colleagues that patient engagement is worthwhile and should absolutely be part of any kind of scientific work?
Well, I think that the experience of be confronting with patients, organization, with the civil society, orient and ameliorate our research is getting better. And you have the sense that you are really achieving a step further brain health for our society. And this is a fantastic feeling.
Thanks so much. And I think that if anybody knows people that are not so convinced about the importance of patient engagement, you can now pinpoint to this webinar and tell them, well, this is a webinar that you should absolutely listen to. You've heard some fantastic speakers that explain how useful patient engagement is and what a difference it can really make. And I think with that, I'm going to hand over to Luca, and she can finish with some concluding comments for this event. And thank you again to my speakers for their fantastic contributions. Over to you, Luca.
And thank you, Jean, for this beautiful session. And actually, I would like to add to the last part of this discussion that I think the passion that we've heard today from our speakers is equally important in conveying the message about patient engagement. I felt it in all of their speeches. So I want to convey a big thank you to our speakers who shared their expertise with us, so from so many angles, and which is so important. And I'm much encouraged by what is being presented from Gwendolina to Monica, the whole broad range from in the brain space. So fantastic, thank you very much. Also to our moderators who've done a great job. So by organizing this meeting and actually labeling it a call for action, we have tried to emphasize the importance of engaging the patient community in the discussions on brain health, with the overall goal of bringing people from the entire community together, outlining what our organizations hope to achieve, and raising more awareness on this important matter. And be a bit thought-provoking, which I think will be the result of some of the presentations indeed. Because, and I repeat what has been stressed by our speakers today, in order to safeguard the future of brain health for patients, which was the title of this afternoon session, it is essential to systematically align all agendas in order to work towards agreed upon commitments to the brain health agenda. It is also imperative that all stakeholders ensure that the priorities, the needs and expertise of all those living with brain health disorders are considered and included. And last but not least, it's important to make sure, as Monica has also beautifully said just now, that research is intrinsically connected to reality. As representatives of people living with brain conditions, all three organizations today, we will continue to fight to ensure that the voices of patients are heard. Alzheimer Europe, EFNA and GAMIAN Europe have initiated this first event together. And I think it has proven to be a unique and well-functioning partnership, which houses a lot of really valuable expertise, and it does give opportunities which I have not seen before. But we are ready to share that with you, the overall community. We will work together to grasp the momentum that we have now, and perhaps even involve other groups. Let us know if you have any topics that you want us to address, so we may make our work more optimally inclusive. And as has been mentioned by Jean or by other people as well, the entire meeting has been recorded and will be available on our respective YouTube channels very shortly. As a final conclusion, I would like to say that meaningful patient involvement, this has been repeatedly said and beautifully illustrated by Helen in her speech, meaningful patient involvement is what we are trying to achieve. And I think we've shown you today that this will happen neither in vitro nor in silico, but it rather needs real patients and active collaboration with patient organizations. And with that, I close this meeting. I thank you from my heart for this beautiful meeting today, and I hope we can repeat it in the near future. Thank you very much.